A very good morning to you. How are you doing? I hope that you're well, you're happy, you're blessed. Karibu sana. It's such a good morning to be here on a Wednesday morning, the 17th of October, 2025. Thank you so much for choosing to watch MBCI TV. We do value your time greatly. Hapa ni ambapo tunabadilisha maisha by the grace of God. And of course, this is Afya Clinic, where we talk about your health and we make sure that we allow you to know every term, medical term, every medical disease. Okay, they are all medical diseases, but in a way that you'd be able to understand and even be at a position to explain to someone what exactly that is. And today we'll be having a very important conversation, so do not miss out. We'll be here up to 10 in the AM. So karibu sana. My name is Rachel Kahogo. We're very happy to have you here. I'd love to know how your week has been so far, and it's been only depending on whether your week starts on Monday or Sunday. It has been like 2 or 3 days. Yeah. So I'd want to know how your week has been so far, what you're thanking God for. Unatuwatch kutoka wapi, unatuwatch na kina nani. We'll be happy to get your feedback. And for that, our numbers are very open. That is 0721-105-105 on WhatsApp, 23814 SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page, live on YouTube on MBCI TV official YouTube page. This amazing morning, we are talking about breast cancer. And this is because the month of October is the Breast Cancer Awareness Month. So we're trying to raise awareness and to help you understand what breast cancer is. So if you have any question, please feel free to ask. And of course, for this particular topic, I am not here alone. I'm here with the doctor, and she is Dr. Kate. But for you to just understand who she is even more, we have a guest profile that will help you understand who she is. As you come back, we'll be coming back to dive right into the discussion. Hello and welcome to Afya Clinic. Today we are joined by Dr. Kate Mandere, an accomplished medical professional with a wealth of experience in the field of medicine and pathology. Dr. Kate holds a Bachelor of Medicine and Bachelor of Surgery degree from Moi University School of Medicine, class of 2015. She has since served with several reputable institutions, including AIC Kijabe Mission Hospital, the Aga Khan University Hospital, Nairobi, and the Nairobi Hospital. She later pursued her specialist training in anatomic pathology at Aga Khan University, Nairobi, and she's currently serving as an anatomical pathologist at GTB Scan Lab in Nakuru. Beyond her professional life, Dr. Kate is also a family woman, and we are delighted to have her on the show today as we discuss an important topic: breast cancer, early detection and diagnosis. Welcome with me on set, Dr. Kate. I'm your host, Rachel Kahogo. Perfect. And Dr. Kate is already here with us. Karibu sana.
Thank you very much.
How are you doing?
I am doing well.
You look amazing.
Thank you.
Yeah.
I'm excited to be here.
Asante sana.
Thank you.
We're also very excited to have you here because I know that the topic you're just about to talk about today is very important.
Yes.
So very happy and delighted to have you here.
Thank you very much.
Asante sana.
Right.
So for the people who are seeing you for the very first time, it will be very important you reintroduce yourself, ndo wasikie sauti yako, and then you can get started. So please introduce yourself.
Already.
Yeah.
Thank you, Rachel. My name is Kate Mandere. For purposes of introduction, I would say I'm an anatomic pathologist, and I know there are people in the audience who might be wondering who the hell is an anatomic pathologist, and so I'll try to explain it so that you understand why I'm here today. So an anatomic pathologist is the doctor in the laboratory who receives your sample once your clinician has seen maybe you have a lump in your breast. They take a small tissue, they will bring it to the lab. It will be my duty to observe that sample, look at it, and decide if you have cancer, what type of cancer is it, how far has it gone, and I'll generate a report that will give you a diagnosis. So that's me for today. Yeah. Thank you very much.
Amazing. It's such a good time to be here to talk about breast cancer. And every time we say that, you know, it's very important for us to have the knowledge of what these diseases are so that you're able to, one, catch it early, but also to just help other people understand what this is. And I'm excited that today we're talking about breast cancer because October is Breast Cancer Awareness Month. But tukisema it's the Breast Cancer Awareness Month, what do you mean by that?
Breast Cancer Awareness Month. It's something that has been there for a while now. Perhaps started around 1985. the main purpose at that time was to try and not only raise awareness, but also try and generate funds that can help advance the research in the line of breast cancer. There were many interests around that time, but as it is right now, we take this month to reach the community, make them aware, especially in our setting where it's not a disease, that has boomed for so long. We've just seen an upscale of the figures in the last few years, perhaps. So it is rather a new thing. People are wondering, okay, there's a lot of cancer. What is causing it? What is going on? What has changed? So in this month, we take the chance to educate the people, to raise awareness, to stand with those who've been affected in one way or another. We also take this time to reach the movers and shakers, in the cancer field, so that there is not only more awareness, but we also have more resources directed to the path of breast cancer and cancer in general, really.
Okay. Why has there been a rise in the numbers of the people who have breast cancer specifically?
All right. There are many things, really, that can be attributed. But from where I stand, I see that our lifestyle has really changed. How we live today is not how we lived 20 years ago. A lot has changed in terms of what we eat, in terms of our physical activity, the level of physical activity, it's changed. The quality of food that we eat, the quality of water that we drink, a lot has changed. The air that we breathe, really a lot has changed. And also, apart from that, there is more awareness now. So people are going to hospital more, and it is also being documented more than it was 20, 30 years ago. So all those are factors.
I hear you. So why exactly breast cancer? As you say, is that you have a lot of types of cancers. So why exactly breast cancer?
I would say, why not breast cancer?
There's that.
Why not? Because really, when we look at the country right now, breast cancer is the second leading cause of death in our setting after cervical cancer, particularly for women. And, that should raise, it makes it clicks somewhere in our minds, because we are losing about 3,000 women every year. And these are statistics from 2022. We don't know how it is right now. But from where I sit as an anatomic pathologist, making these diagnoses every day, I can tell you for sure I'm diagnosing more cancers now than I did a few years back. So I would say the numbers are increasing. And it is not only affecting the older population, it is affecting women as early as their 20s, their 30s. This is why we need to have that conversation, because it is not a far-off thought. It's something that could strike any time.
Okay. Now, for the people who are hearing about breast cancer for the very first time, which is very unlikely, but there are people who are hearing it for the very first time. So in layman's language, what is breast cancer?
All right. So the best way for me to explain what breast cancer is will be for me to try and figure out the structure of a breast. What really is breast tissue? Because once you understand that, then you'll know how the cancer comes about. So the breast tissue is made up of, I would say, three main parts. We have the fatty tissue. Then we have the breast glands themselves, where the milk is produced. And now the channels through which it passes for it to reach the nipple, where the baby will get the milk. So the cancer could arise in any of these three parts. It could arise within the fat tissue, could arise in the glands themselves, could arise in the channels that pass the milk. So based on that, you can have ductal cancers, that is the most common one. You can have lobular cancers, those are the big glands where the milk is being stored. But also that connective tissue, that fat that surrounds those glands can also become cancerous. So cancer is an abnormal growth, that is what I would say. So when these tissues start multiplying abnormally, they will form a lump, they will form a mass. That mass is difficult to control because it doesn't follow the normal rules of the cells. When that happens, then you say you have cancer.
Okay. So what attributes to one having breast cancer? Or what are the risk factors?
All right. So I would like to say that at this moment we can really mostly talk about risk factors. We may not be able to say causes per se, because cancer is a multifactorial disease. There are so many things that come together, to pull that trigger for you to get that cancer. So let's talk about the risk factors. One is being female. One is being female in the reproductive age. Yes, because that is when the hormones are all over the place. Sometimes the estrogen is up, sometimes the progesterone is down. All these hormones have an effect on the glands, especially. They do affect how it proliferates or how it grows, how those tissues grow. When there is overstimulation by the hormones, there is a risk that they will grow beyond their normal bounds. So that is one thing, being female. And we say breast cancer, 99% of the diagnoses affect females, and there's a 1% for males. It still occurs in males, but it's far much less compared to women. The other thing is age. So for the cancer that we see in Kenya particularly, we see that it starts much earlier. So between 30 to 55 years of age, that's why we have our peak incidence. That's where the most women will present. So being in that age group will predispose you. And the reason is because you've been exposed to these bodily hormones for so long. The more you're exposed, the longer, the higher your risk becomes. So that is another thing. In the Western countries, their peak starts around 50 years going forward. And those are issues of genetics that we can talk about at another time. Still speaking on the issue of genetics, there's a small percentage of cancers, about 10% of them, that are really genetic. They're in the family. So that if you have a close relative, we call them first-degree relatives, your sister perhaps, your mom perhaps, who had breast cancer, then there's a big risk that you might also be affected. There might be a gene in your body that has been transformed, and it is making it more likely for you to develop the cancer. So that is another thing. The other thing is our lifestyle. So for the studies that have been done in Kenya, it is clear that about 80% of the women who got breast cancer were also found to be overweight or obese. While we may not say it is a cause, it is definitely a risk factor. And the reason is most of the estrogen is manufactured within the fat cells. So the more fat cells you have, the more estrogen you will generate, and the more that estrogen will transform or tend to make the breast tissues proliferate or grow more than they should. So those are some of the risk factors I believe we can talk about at this time.
And now that you've talked about the study in Kenya, how common is breast cancer in Kenya?
All right. So I would say I would relate it maybe to the other cancers so that we get to understand it well. So breast cancer currently is the second it's the second most frequent cancer that we see in Kenya. For women, cervical cancer is still up there. It's still up there. But in this setting, I think cervical cancer, we see a larger incidence more in the western part of Kenya, going towards Nyanza. It is much higher there. But on this other side of the country, I would be right to say breast cancer is like the leading cancer that we see in women. And we see that it affects about 25%. It's about 25% of all the cancers that we have, which is a big percentage because that's a quarter. So it is affecting many women. We get about 7,000 diagnoses in a year. That is really up there.
That's huge. That's a huge
about 7,000 new cases. New cases per year.
That's a really huge number.
It's a big number.
It's a huge number. And at the end, we'll be looking at, is there anything you can do to avoid getting breast cancer and any other kind of cancer, really?
Definitely.
We've talked about breast cancer being high in women. And we've talked about a 1% in men. What does it look like in men?
I see. So breast cancer in men is similar to breast cancer in women. If I was to give you the tumor, physically, you will not be able to tell that this is from a man and this is from a woman. They really do get the same disease. Unfortunately, actually, I do think men are a bit disadvantaged, because by just the knowledge that we say, oh, it's more common in women, they tend to come much later, you know, because they'll be like, I don't think it can be cancer, it's a disease for women, you know. So they will tend to present a bit later because of the confusion, you know. It's assumed to be a women's disease, you know, but it actually happens in both men and women. But structurally, biologically, it's the same disease. It's just that because the men perhaps are not affected so much by the hormones, then now their risk is much less. But it is there. Okay.
So now, how does it present in general? Because you said for men and women, it's the same.
It's the same.
So how does it present?
Already. So there are many signs that you might see. We'll talk about the signs and the symptoms. All right. So the signs, the symptoms that you might see, you as a man, you as a woman, you're at home. The most common one is a lump in the breast. A swelling. I believe as you take care of your body, you get to know this is how my normal breast is, and this one is off, this one is not the usual. So I would say the breast lump is the commonest thing. You will feel there's something. But what worries us most as clinicians is when that lump is hard, it's persisting, it's not going away, because sometimes as the cycle, as a woman's cycle goes along, there are some changes in the breast. Sometimes the breasts feel heavy, sometimes they feel a bit painful. So they're usually those general changes. But if there's this lump, it's not going away. It's been a month. It's not going away. It's hard. That should be concerning for you. And because you at home might not be able to know, well, this is just a normal swelling, this is a cancerous swelling, then the best thing for you will be to get checked so that that mass can be determined. What kind of growth is it? So that is one thing. The other thing you might notice is a discharge. A discharge might be common in a woman who's breastfeeding, for instance, and the discharge should be just milk. Anything apart from milk is not a normal discharge. If it is yellowish, if it is bloody, in fact, we say the moment you see a bloody discharge, do not sit at home. That is a danger sign. So a bloody discharge is not normal. If you're not breastfeeding and you're getting a discharge, that is not normal. So that should make you get concerned. Some people will get swellings in the armpit, for instance. And that is because the lymph nodes that now serve your breast are beginning to be affected. They're overworking, right? But further down the line, it might be a sign that the disease now is traveling beyond the breast to other parts of the body. And usually it cannot bypass the lymph nodes that are there in the armpit. So if you get that kind of swelling, that is not normal and it should make you concerned. Another thing is changes around the skin of the breast. It can become quite red or very dark or hard, very hardened, or it can get an ulcer. An ulcer is like a wound, I would say, a break in the skin. Those are not normal findings and they should make you alarmed. The other thing that I would like to remind the viewers is that ideally as a woman, even as a man, but as a woman, you should always dress in front of a mirror. Why do you need to dress in front of a mirror? You need to check the symmetry of your breasts. Of course, wherever we have two things like two breasts, two hands, two legs, there's always one that is slightly larger than the other, but there is asymmetry that will be beyond the normal. You'll be able to see this breast looks larger, quite larger than the other one, or it looks swollen towards one side. So that kind of asymmetry in the breast is not normal, and that should make you think that there's something going on. The other ones are general signs that will be there in any cancer. Sudden weight loss. You've lost more than 10 kilos in 3 months and it was not intentional. You can lose weight intentionally, but when it's not intentional, you're losing weight, sweating too much at night, such kind of things, those are red flags.
Okay. And I love that you've mentioned even the signs that people would think, this is just normal, let me just give it time. You know, as Kenyans, and how we love to use Dr. Google, now with ChatGPT, we try to Google the symptoms, but you've said especially if you see a discharge with blood, that's a danger sign.
Yes.
Go get checked.
Go get checked.
That's a danger sign.
Yes.
Yeah. So even as we continue, if you have any question, please feel free to ask, and we'll be happy to read and to definitely get back to you. That is on WhatsApp 0721105105, and of course our SMS code, which is absolutely free of charge, 23813. We are live on Facebook on MBCI TV Facebook page, live on YouTube on MBCI TV official YouTube page. So on the comment section, we'll be happy to hear from you. For now, I'd love for us to get the Vox Pops. Now, this is just a segment where people will tell us what they know about breast cancer, and then Doc will be commenting about it. Tuone mahali tuko, if we really need to raise more awareness about breast cancer. So let's get to the Vox Pops.
Breast cancer inaweza letwa mtoto asiponyonya kabisa. Anasikia anyonya maziwa ikwishe. Hiyo ni moja. Ingine labda diet na zile tunakula, chemical zile ziko tena, hizo zinaweza. Mimi najua hizo mbili tu.
Causes of breast cancer, the ones that I remember vividly, one is genetic. Yeah, so if, for instance, in someone's lineage, one of their predecessors, one of the predecessors had the history of breast cancer, possibility of that person to have breast cancer is high, and also pre-exposure to, which I know is that one of the reasons that predisposes people to cancers is that if you expose yourself to radiations, there are radiations that causes mutations to the genes in the system, might also predispose you to breast cancer. Also, what you eat matters a lot towards contracting cancer.
Nikifikiria kenye kinaweza kuwa kinaleta breast cancer, lifestyle na zile chakula tunaendelea kukula ndio kupigwa dawa, so za zingine zinaweza kuwa ndio zinaleta
breast cancer. Sini kansa ya matiti ya wanawake inaletwa na shida mingi. Shida ya kwanza, kuto kunyonyesha mtoto kikamilifu. Mwanamke anaponyonyesha mtoto ni lazima zile matiti iondoke maziwa, na iwe na time yake, kwa sababu itatibidi inaenda na time yake, na akikataa itabaki, na ile ikibaki, kwa sababu inabaki ndani ya matiti, sasa ile huanza kujikoroga. Kama hana ujuzi, anasikia uchungu, anasikia anachomwa, hana ujuzi wa kujua ya kwamba naweza kuwa sasa kumletea arthritis, ni ugonjwa wa maziwa, bado sasa italeta breast cancer. Lakini kitu kimoja muhimu sana ni hii, unaona watu wengi wamekuwa na magonjwa ya syphilis na magonjwa ingine na magonjwa zingine za wanaume na wanawake, na hizi hawataki kutibiwa vile ilivyo. Wanaenda kununua dawa, wanatumia. Wakitumia ile hakumaliza, wakati atapokuwa akifanya yale mambo na mpenzi na mke, naleta kansa. Kwa hivyo kansa, nimekaa kama mwaka 50 na nyama, na nilifanya uchunguzi mimi nikitaka kujua, na madaktari kama mwaka wa 73, 74, 76, 77 walikuwa wakija kuchunguza kwa watu ya nyama ili wamueleze kansa ni inatokana na nini. Lakini sasa kansa kubwa ile nimeona ya matiti ni hiyo. Kama ni ng'ombe, kama haikomuliwi, inapatwa na mastitis. Hivyo ndivyo wanawake wanapatwa kama hai. Na ujue yeye anasema hasikii uchungu, lakini bado anasema nika uchungu kadogo tu, hajaenda kwa daktari. Ningeomba kila mmoja, mwanamke wote akisikia kuna shida yoyote kwa matiti, asiende kukunywa ini pandando, asiende aende direct aone daktari, na mueleze kwa muda ule amesikia, naye daktari atamsaidia, atajua shida yake iko wapi.
Breast cancer mimi nafikiria hutoka na chakula zenye tunatumia siku hizi. pa kuwa zinawekwa kwa mashamba na madawa, zinatolewa na dawa. Sasa hizo ndio zinatudhuru.
Loved how the man rather, has explained it in depth. Yani explain mpaka akatupa instructions. Akasema, ladies, if you feel any pain, enda hospitali na mwambie daktari umekuwa ukisikia uchungu for how long. Yeah.
Couldn't agree more.
Yeah.
Couldn't agree more, really.
What would you comment from all the vox pops, all the people that we've had?
Yeah.
Is there something you'd want to correct or add on?
Already. I like the fact that many people actually talked about the aspect of lifestyle and the impact it has, the food that we eat, all the agrochemicals that are in there. You know, sometimes you may not even be too sure about the vegetables that you eat. Could be having lots of chemicals in there. And the problem with chemicals is they attack the genes eventually. They alter the genes, and that is where the issue begins, because cancer is really a genetic disease. It begins with an alteration in your DNA. Then you produce abnormal cells. Those abnormal cells keep multiplying indefinitely, you know. That is where the problem begins. So I commend those ones. I also had the old mzee speak about the issue of breastfeeding, maybe, which is an interesting thing. Maybe we can dive into it a little bit. So far, what we are able to do is to make associations. We observe, then we say, okay, this could be related to this. That's how studies, are done. So what they have seen is that, in the past, like in Africa, women will give birth to several children. Each of those pregnancies usually is like a progesterone surge. You have a lot of progesterone during that period of pregnancy. So having many children means you'd have many of these progesterone peaks, which are kind of breaks in the estrogen, Estrogen is what will drive the breast to grow and, to produce the glands. But progesterone is like the brake. So now they used to say, there are less cancers in Africa, let's say, because they tend to have many children, meaning they have more of these progesterone peaks, which are protective, really, in terms of the breast. The other thing that has been associated for studies is breastfeeding. The longer you breastfeed also, the more it's like you put a brake on those hormones as well. That is why it is said that having children, breastfeeding, they're protective for women. And now as we see our lifestyle changing, of course, even the birth rate amongst the women has dipped. It's not as high as it used to be. Even if you breastfeed, you may not be able to breastfeed as long, as how women used to breastfeed some time back. So our lifestyle has changed. There are good things that have come with that, but again, also, in terms of a woman's profile, there's some losses as well. There have been gains, but there have also been some losses. But let me also be quick to say that women who have children, women who are breastfed, still do get cancer. So I would not like the listener to think that perhaps if you are breastfeeding, if you're having many children, you're safe from cancer. That is really not the reality. It's just that having done those things lowers your risk. But because cancer is a multifactorial disease, as we said, there's genetics, there's the environment, there's this and that, there are many other factors that come into play. So in as much as it is protective, it will also be good for the viewer to know that it's not foolproof, it just lowers your risk.
Okay. Now we have someone here who's asking, does things like diet, alcohol use, and physical activity play a role in the breast cancer risk?
That is really spot on, because those three factors are actually documented as significantly increasing the risk of a woman getting breast cancer. Just the three, as they mentioned: physical activity, alcohol consumption, they are all directly, really, they have been implicated. So if you can be more active, if you can avoid or limit your use of alcohol, if you cannot avoid.
In fact,
why not?
avoid.
Why not?
Let's talk about diet. When you talk about diet in breast cancer, how is it related?
How is it related? So what comes to my mind is another study that someone did. And they tried to get a profile of who are these women who are getting breast cancer in Kenya. They found that the Bantus are the leading in terms of suffering breast cancer. So when I think of Bantus, I think, what is our lifestyle like? What kind of food do we eat? And they saw that really our food is heavy in starches, really heavy in starches.
Really?
Think of potatoes, think of maize, think of all these starches. While whole starches are good, but really when our foods are predominantly made of starch, then there is a risk there, because our starches are converted mainly into sugar and fat. The more now you're converting your stores into fat, again we said the more estrogen you're going to manufacture in your body, and the more it's going to affect your breast tissues. But further beyond that, I think, is the subject of agrochemical use. Because some of the chemicals that are used down in the villages, they're not safe. Some of them are really toxic, you know. And unfortunately, you will get it in the food, really. And when you buy in the market, there's no way to tell this is clean, this is not, you know. So we do consume some of that as we go along in life. So I think those will be some of the things I would say. Another thing is micronutrients. Our small minerals, you know. How much of it do we really take? How much of our food is fruits and vegetables, right, in a typical day? Lots of coffee, lots of bread, you know, lots coffee. Right? We really miss out on the micronutrients that you'll typically get in your fruits, your vegetables, your nuts. You know, we really do miss out on those. And those, you know, are the gatekeepers for the cells. So I think, it's time to relook.
So especially your diet, when you talk about diet, it's very important to take care of yourself. Check on what you eat. Sometimes we don't like to have this discussion a lot. We just, you know, get a quick snack, continue with your day.
And you're fixed for the day.
You're fixed for the day. I had someone saying, that someone could be here, had someone saying that all I need is sugars. As long as I have the energy to go through the day, I'm good to go. And they'll survive on things like chocolate, juice, you know, things with sugars, and they'll keep going. So I think that is something we all really need to look into. I'm a victim there, so help me God. Now, let's look at some of the early detection. While you talk about early detection, we'll probably start by self-assessment, which is very important. Is there a way you'd know that what I have is breast cancer, just by yourself?
By yourself. There'll be signs. At least most times there will be signs. If you catch it early, maybe you may not really know. Early detection. Let me start by saying, as I said when you were starting, as a woman, you need a mirror. You need a mirror. The mirror will show you something that before your hands touch it, you might see it. So always check for the symmetry of your breast. Look at that skin. Is it normal? Is it not normal? Once in a month, you can try and examine your breast. You can feel it. You'll be able to know the normal feel. The trick is to know the normal feel of your breast. So that if anything comes that is abnormal or that is out of the norm, you will be able to realize it. The same way, you know, the back of your hand, you know, you'd see a pimple very quickly, you'd see a scratch. That's how well you should also know your breast tissue. So that if there's a lump coming there, you'll be able to pick it really early. But apart from self-examination, which is very important, really, I would say we need to regularize or get used to going for screening. Not just waiting for the symptoms, but scheduling, you know, that appointment yearly, for instance. Just get that ultrasound if you're below 40. Above 40, get that mammogram. Because how else would you know? Some of these lesions are so small. It could be 1 centimeter. 1 centimeter is like the tip of your finger. Even if you were to feel around your breast, really you may not feel it. Even the doctor might miss it. But if you're doing those regular screening, you're doing your ultrasound, you're doing your mammograms, at least yearly, then for sure you'll be able to catch that thing if it's in good time.
Yeah. Okay. I love that. We've talked about mammogram, we've talked about ultrasound, you know, all that.
Yeah.
But in general, we talk about screening. You know, go for screening, get your screening.
Yeah.
In layman's language, screening nini.
Screening nini. That's a good question. Sometimes it's easy to assume because, you know, I'm always in the clinical setting, so I'm like, screening is screening.
Yeah, like just go for screening.
Go for screening.
What do you mean?
But what is screening? Screening is like a way of, you know, when I look at a population, when I'm saying screening, it's like if you have sheep and goats, you want to separate the sheep on one side and the goats on one side. Meaning someone needs to look at your body and see, is there danger? Is there no danger? That is really what screening is about. Okay. So screening is a combination of things. One is a physical examination. What's a physical examination? So the doctor will manually feel, they will look at your breast and manually feel and see if there is something there that is worrisome. They will also check your armpits because we say that your breast cancer will visit when it leaves the breast. The other thing they will do now is to go to other methods of detecting whether there is a problem or not. And those are the imaging studies. So in that case, then we usually stratify or we break into two groups. The younger women, because their breasts are more heavier and we have more of the gland tissue, they will get ultrasounds. So an ultrasound, it's like a window maybe into your breast to see is there any abnormal masses there. That is what an ultrasound will be. It's totally painless. Just a few minutes, perhaps 20, 30 minutes, you'll be done with the process. And then the radiologist will be able to give a report. Above 40 years, the woman's breast changes. It has more of the fat, less of the glands. So in that case, then the ultrasound will not be a good method. Then now we use the mammogram. Mammogram is a type of X-ray. You can call it an X-ray of the breast. So your breast will be exposed to the X-rays, and they will be able to see if there is something in there as well. In as much as it might have a bit of discomfort, it is a procedure that you can really do. It's not invasive, no needles, no nothing. It's just the picture, then you get your report. Once a year should be sufficient, not unless you're really at risk, but once a year is sufficient. So those are the screenings we do, particularly for breast cancer.
I love that. And it's good that you've explained it very well. And we'll be looking at some of the questions that are coming in because I see we have questions that are coming in already. So just to remind you that our numbers are very open for the questions. And on WhatsApp, it's 0721 105 105. Our SMS code is 23814. It's absolutely free of charge. You're live on Facebook on MBCI TV Facebook page. You're live on YouTube on MBCI TV official YouTube page. Also, you can just drop in there and tell us how you're doing. I see you have people who are doing that already. It's absolutely okay. So you can do that and then ask your question and we'll be happy to read it. Now, we've mentioned about the ultrasounds that you've told us. They're absolutely not painful, they're painless, so you can go get checked and you'll be good to go. But every time we talk about these screenings and ultrasound, people ask, kuna side effects? Is there a problem? Nitatoka ultrasound alafu niende nyumbani nikisemanga I've been having very bad headaches or nausea. Are there any side effects of the screening?
Already. So for the ones, today we're talking about breast cancer, so I'll try and stick to breast cancer. At least none in my knowledge. Right? The ultrasounds, totally pain-free. I really don't see any that you'd say will be a side effect. For mammogram, you might feel a bit of discomfort in your breast because for the breast to fit on the platform, there's a position, there's a positioning. Maybe that kind of discomfort, but it's really very short-lived and it shouldn't be one to make you not go for your screening. But beyond that time, when you're there with the doctor, really, no, none.
Perfect, works well. We'll be talking about the misconceptions and the myths immediately after the break. But what are some of the myths that you've specifically faced in your field of work?
So I think the one that I see most, and this is really unfortunate, is that people still look at cancer as a very mysterious disease and perhaps one that, you know, has a spiritual element to it. Yeah. People do think that there could be a curse, you know, somewhere. And there are people who are marginalized actually because of their cancer diagnosis, you know. Like it's a bad luck, you know. I think that is the one that I see the most, and it is really unfortunate because cancer is a biologic disease. Just like you suffer malaria, you suffer typhoid. It's a similar disease, really. But I've seen quite a number of people who say they're cursed in their family or their lineage and things like that.
I hear you. What would you do to reduce the stigma that's around breast cancer?
There's lots of stigma, really. It is not strange in my eyes because think of the days when HIV first came to the country. There was so much stigma, you know. It was a strange disease. And whenever people do not understand something, they will always, you know, make stories around it, you know, to suit what they already understand. So it is not strange. But what I saw made a difference during that time is educating the masses, raising awareness, making people understand that this is a biologic disease and someone may not necessarily have done anything to get it. You know, it is not like you did this, you got this, you know. It is really, in fact, around 90%, only 10% we say is like family or genetic. That breast cancer. The rest of the 90%, we call it sporadic. It just happens, you know. 1 and 2 and 3 get together and you get a cancerous cells and it just starts growing in your body, really. So I would say creating awareness is the key because the more people understand that this is a disease that can catch you, can catch me, can catch my neighbor, my mom, my sister, anyone, then now they begin to understand that it's a reality. It's something that is around us. We cannot run away from it. And then we take steps, you know, towards either avoiding if you've not gotten it yet or managing once you have the diagnosis.
Okay. Perfect. So that is good. We'll be taking a very short break and then we'll be coming right back. So just to remind you, this is MBCI TV ambapo tunabadilisha maisha by the grace of God. And of course, the show on air is Afya Clinic. Today we're talking about breast cancer. We're doing that with Dr. Kate. Thank you so much for being here.
Thank you.
Yeah, a very short break and then we'll be coming right back soon in Mali.
MBCI Television, transforming lives.
Out of my belly.
Shut up, everybody. Listen.
Jesus, you reign. Jesus, you reign. Today, tomorrow, and forever. Out of my belly.
Kuna hawa maserafi na makerubi, kazi yao kwa kanisa ni gani?
Hey, y'all, come look at this.
Kuna wenye wanaamini Mungu, kuna wenye hawaamini Mungu.
So hawa wenye hawaamini Mungu, hawa maserafi na makerubi wenye hawaamini Mungu, unaweza waambia nini?
Inafaa tuamini Mungu sisi wote kwa maana sisi ni waubaji wa Mungu.
Talo.
Nataka urudie mara 3. Lori lile juu ya reli lilibiringika. Lori lile juu ya reli lilibiringika. Rudia mara 3 mbio mbio.
Lori lile juu ya leri lilibiringika. Lori lile juu ya leri lilibiringika. Lori lile juu ya leri lilibiringika.
Burudia.
Tattoo City and the environs. Are you ready? The heavens have opened with blessings beyond measure. It's time to walk in your inheritance. Reverend Peter and Pastor Florence Kamau, senior pastors at the Tatu Chapel, presents the Inheritance Summit 2025.
I don't know the darkness that is up upon your life, but I want to say that I am. He is rendered to thunder in the name of Jesus.
The conference begins on Wednesday 22nd, Thursday 23rd to Sunday 26th October 2025. Venue Eastern Bypass, Roiro Membli, just 200 meters behind Overstone Hotel, next to Muhen Heights. Theme: Blessings Beyond Measure. Schedule: our meetings begin on Wednesday from 5 p.m. to 8 p.m. and Thursday to Sunday from 9 a.m. to 8 p.m. with guest speakers Bishop Margaret Wangari, Apostle David Juma, Apostle Julia Subi, Evangelist Lucy Wangonjiri, Bishop Thomas Move, Pastor Micah Motune, and Apostle T. Mwangi. Music by Tatu Chapel. Come expectant for mighty move of God, impartation, healing, deliverance, and divine encounters. Your time is now. Kenya.
Arise! Arise!
It's time to catch the fire of repentance revival with missionary pastor Robert Kalansi from Australia.
Every demon in the land, every principality over this nation shall bow to the name above all names.
Come worship with us as we call forth Kenya's revival. Dates: Friday 24th October from 3 p.m. to 8 p.m. and on Saturday the 25th of October at 9 a.m. Venue: Western Hotel, Langata Road, Nairobi, Kenya. This two-day conference will be climaxed by a powerful water baptism service on Saturday 24th at the same venue. For the kingdom is the Lord, and he rules over the nations. Psalms chapter 22 verses 28. Come and be part of a powerful move of God in this prophetic end time hour. Follow us live on Robert Clancy's pages on YouTube and Facebook. YouTube, Repentance Revival. Facebook, Repentance Revival with Robert Clancy. For more information, call 0712 477 334. Visit us at www.repentancerevival.com.
He is calling the eagles from the east, from the south, from the west, from the north.
The meetings are absolutely free and open to all.
I'm done.
I'm also done. When were you planning to tell me all this?
When are you also planning to tell me all this?
Bishop Ben, I had an issue. Yeah. I guess I had told you something about me and Grace. Sister Grace.
Please. Mimi maneno yako sitaki. I want us to end this thing.
MBCI Television, transforming lives.
Perfect. Thank you so much for staying. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. This is the right place to be. Thank you for choosing to watch MBCI TV. We do value your time greatly. This is Afya Clinic, the show on air, and we're talking about breast cancer today. And this is because October is Breast Cancer Awareness Month. And we say that the reason why we are having a whole month to talk about breast cancer, it's because we need to raise the awareness, but also just to bring together more funds to be able to help the people ambao wako na breast cancer and to bring together more support for these people. yeah, which is very, very important because they're part of our family. And we say that it's a disease like any other, and God forbid, but anyone can get it. Yeah, so that's why it's very important for us to talk about it. So karibu sana, we're happy to have you on board for you to be able to get everything about breast cancer. And today we are here with Dr. Kate. And you're able to just unpack everything. So if you have any question, we'll be happy to hear from you and we'll be happy to answer. I see people who are tuned in. We have Mary Wangeshi from Thika. I see you. Thank you so much for being here. We have Mokami Nancy. Anasema, good morning and praise the Lord. Amen. Following from Juja. Asante sana. Tukana Phoebe. Asante. Anasema, Dr. Kate, thank you. It's very informative. Asante sana. Tukana Mokami Nancy. I've also seen your question. We'll be talking about it. Do not worry. We have CEO Tito. Thank you so much. We have Ventrine. I see you. Thank you so much for tuning in. God bless you. Now, we'll be talking. I want to talk about the myths because there's something that you've mentioned that we still have people who would think breast cancer or any other type of cancer is a curse, and they associate it with ulifanya nini, that the fact that you have a cancer, it means that you did something wrong, which is very wrong for us to think about it like that because it's a disease like any other, and that is why it's very important for us to talk about it so that you're able to demystify. Now let's take a look at the mythbusters that we have. And the first myth is that if there's no family history, you can't get breast cancer. What do you think about it?
Wow, that is quite unfortunate because really the statistics that we have in our country is that only about 10%. Perhaps if we even stretch it a little bit for the sake of those who might not have been in the studies, we'll get to 20, maybe 15%. Only those ones have a family history. The rest have never had anyone in their family suffer breast cancer or any other cancer for that matter, really. So I will not agree with that myth. And it will be important for us to know so that we know that the risk is open for any man or woman out there. We are all at risk. We never know when it will be your turn. And it does not have to be your family member who suffered it before.
And it's good that you say it for any man or woman. So that, and I pray that we get to a point where our men will be able to go to hospital immediately they see anything wrong. Because they're very strong people and that's a good thing. But once you see anything wrong, please go to hospital. Usingoje mpaka it's too late. Because you've seen that sana. Where the men will wait until it's too late, you know, they'll try staying strong, taking a painkiller here and there. Mpaka it's too late. And there's a man you mentioned, the Vox Pops, who was asked about breast cancer, and she said, "Hiyo ni ile ugonjwa ya wanawake," you know, which means it's already classified as a women's disease. So it's very good for us to know that. All right, on to the second one, is that living a healthy lifestyle means you're safe from breast cancer.
You know, that statement is partially true, but it is the error there will be when they say it means you're safe. Living a healthy lifestyle really significantly reduces your risk, but it does not eliminate the risk. Because you still live in this world, Rachel. There are still things that are beyond, you know, what you can control by lifestyle. Talk about genetics, for instance. You are really not in control of that aspect of your life. So living a healthy lifestyle is commendable. It is to be encouraged, but it does not rule out the possibility of having breast cancer or any other cancer for that matter in your life.
Alrighty. And on the third one is that a lump in the breast always means there's cancer.
Actually, the good news is that only a few of the lumps in your breast will be breast cancer. We have many other lumps that can come into a woman's body or a man's body. Let's keep that discussion both ways. There are many lumps you can get. For instance, if you're breastfeeding as a woman, you can get an infection in your breast. That will be the mastitis. You will feel a lump in your breast. That is one thing. The other thing could be the milk could jam up in the breast. That will be a mass. That would not be cancer really. It's very treatable. For young women, late teens, early 20s, even 30s, you can have other swellings that are just lumps of breast tissue, not cancerous. Medically, we call them fibroadenomas. It's just the breast tissue, really. Just growing, not normally, but it's forming a nice lump. It will never travel anywhere. It will never give you any risk. It will always be in your breast. As you grow older as well, the breast will undergo changes. Sometimes you get cysts forming within the breast. That will also form a lump. So the good news is that not all the lumps in your breast will be cancerous. But from where you sit, you will not be able to know that this is the safe one, this is the cancerous one, and that is why we keep insisting on the need for screening and early detection, early treatment.
So go get checked.
Go get checked.
Go get checked. All right. And the other one is that breast cancer only affects older women.
In fact, in our setting, we see quite the opposite. We see fewer of the older women, more of the younger women. So our peak, as we were beginning, we said we have more women being affected between 30 and 50 years of age. That is the interesting, it's just a new, like when when the studies first started on breast cancer, they were done mostly in Western women because that was where the disease burden was. But we are seeing more and more women from low and middle income countries getting this disease, and they're wondering, okay, let's study it now in this other population. And they're seeing the statistics are worlds apart, quite literally, because there in the West, their disease starts much later in life. In our setting, it's quite the opposite. It's a very aggressive disease in our setting. In the West, many women survive. In fact, the statistics now is that at least half of the women perish each year out of breast cancer. In the West, only about a third die in a year, perhaps. Those are very striking features. And of course, there's the part for coming in late for treatment, but also genetically and even biologically, it is a different disease. It is not the same disease as you see in the West.
Wow, I hear you. And the other one, we've talked about it, is that only women get breast cancer. That we know. That is not only women, but as you said, is that it's 99%
women.
And you give the reasons why, and it's 1% of the men. To think that's clear. And the last one is that a mammogram can cause breast cancer.
That is a good one, because someone will think, oh, that's an X-ray. But a mammogram will not cause cancer, really. I think, let me just put it out there. Because that might discourage someone from, screening, right? But for breast cancer, I would say the amount of radiation that you receive from one exposure of a mammogram is similar to the terrestrial radiation or the radiation you receive from the environment on a daily basis, really. So I would say no. I would say no to that one. It's just the same, because you do receive radiation from the Earth's surface every day as you walk along the surface of the Earth. There's that radiation you're exposed to. It is quite similar, and it does not add to your risk.
Okay, I hear you. Now let's talk about the treatment options. Now that we've known how you'd be able to know that this is cancer, this is not cancer. So once the diagnosis is out and umembiwa now, we've realized that you have breast cancer. What are the treatment options?
All right. So for one, I would say first, before the treatments begin, there's some processes that you'll go through. First, the doctor might want to take a bit of that tumor, just a tiny piece of it, and have it examined in the laboratory. They will need to decide what type of cancer it is, because they are not all the same. There are several kinds of breast cancers, and a cancer in person A may not be the same as the cancer in person B. So they will need to bring it to the lab. For instance, to me, I'll be able to say what grade is it, because we usually grade it from grade 1 to grade 3. Grade 1 being a good grade, let's say.
Yeah.
And grade 3 being that the disease is really aggressive. Then after that...
So is that like the stage 1, stage 2,
that
stage
will
3
be
of
different
cancer?
now.
Okay.
That will be different. This one is like trying to understand the biologic stage of the disease. You know, what kind of cells are there? Are they very ugly, very big, very malignant cells, you know?
Yeah.
So that will be one. Once we grade it, there will be another stage. The next step now will be staging. Staging now is like trying to see, is this cancer limited to the breast? Has it moved beyond the breast to other parts of the body?
Yeah.
It could move to your lungs. It could move to the liver. It could move to the brain.
Yeah.
That is the staging. Stage 1 and 2 are diseases that are limited really to the breast.
Okay.
Once you go beyond that now, you're saying that the risk that it has traveled to other parts of the body is much more. So there will be imaging studies that will be done. They will do some CT scans, and nowadays we also do PET scans. All those will be just trying to see how far has this disease gone.
Yeah.
Based now on the type of cancer you have, on the grade that it is, on the stage, then now the doctor will decide which treatment will be best for you.
Okay.
So treatment can look as many things as possible. It can be a surgery. Stage 1, stage 2, we are talking about surgery as the primary main of the yes. So surgery to remove that tumor out. Beyond that, there are still other things that will be done. We have chemotherapy.
Yeah.
What does chemotherapy do? It's really targeted at killing those cancer cells. Sometimes it is done before the surgery so that the tumor shrinks before the surgery can be done. Sometimes it is done after the surgery so that in case there were any tumor cells that were left, those ones can also be targeted.
Okay.
So we've talked surgery, we've talked chemotherapy. There's also radiotherapy. Radiotherapy works similarly to chemotherapy.
Okay.
The main purpose is to kill those cells because they are rapidly dividing, and that is what gives them that is what enables the medications to reach them because they are very, very active cells.
Yeah.
So that will be the radiotherapy, and it is not for everyone. It will really be determined, as you've said, by the extent of your disease.
Yeah.
Then now we have new therapies that are coming in, you know, with more research. We are doing more targeted therapy.
Yeah.
So that we say that your cancer is not the same as your neighbor's cancer. It is very particular to you. So we are seeing which genes are affected. Can we target those particular genes, you know? There are all those new therapies out there.
Okay, okay. And the good thing to say is that we have people who are working free from cancer now, and they had cancer. Is that cancer is not fully a killer disease as it's portrayed. Yeah, I've had people saying, "Wow, unajua ukipata cancer now, that's just it. Sasa wewe umemaliza," you know. But no, it's that this. When you're talking about treatment, it means there's hope at the end.
There is hope.
Yeah.
There is
In fact, maybe just talk about it in a minute and tell us what percentage of people who've come to you with cancer have you seen at the end ringing the bell and they're now walking free from cancer?
I see. I would say, let me just start by saying cancer diagnosis is not equals to death.
Yeah.
There is hope. There is hope because, as we've said, the biology of this tumor is very different from person to person. And sometimes it's hard to give a prediction. You know? Sometimes it's hard to say this one. Of course, there are things we would see that will say, okay, this one is likely to do well, you know. But I would say the bottom line is when you catch it early, the chances of you know, getting through and getting cure, you know, being cancer-free are much higher. The later the stage, and that is unfortunately where we find most of our population being in. Most of our patients, more than 3/4 will come in stage 3, stage 4. At that time, the disease has really traveled to this place and this organ and that organ, which makes the chances of cure very low. Yeah. But even then, I would like to encourage the viewer, the listener, that there has been so much advance in terms of breast cancer treatment. Like the treatments that are there now compared to 5-10 years ago, very, very different. Many people are making it, and not just making it, but thriving, you know, because there's life and there's quality of life also.
Yeah.
I
love that.
Yeah.
I love that. Now, let's get the Did You Know segment, and then after that, tutakuwa tunakuja kuendelea na discussion and also just to answer your questions. I love how you've explained it, that catch it early.
Yeah.
But we pray that you will stay safe, eat well, healthy diet, do not take alcohol. Yeah, because we need all of us very safe.
Right.
But for now, let's get the Did You Know, not Did You Know rather, we'll get the healthy living, yes, by Sylvia Wandra. And healthy living just allows us to see what exactly you're supposed to do to live a healthy life. Yeah, what are some of the preventions method, and we'll be talking about that. What can you do to make sure that you prevent yourself from getting this type of cancer or any other type of cancer? Yeah, so let's get the healthy living segment, and then we'll be coming right back. Usiende mbali.
Hello and welcome to Afya Clinic, your trusted health companion where we talk about ways to live a healthier and happier life. Today, we are focusing on a topic that affects millions of women and even some men around the world: breast cancer. Breast cancer is one of the most common types of cancers among women, but the good news is with early detection and awareness, it can be easily treated. So let's take a closer look at what causes it, how to detect it early, and the simple lifestyle choices that can make a big difference. Let's dive into causes and risk factors. While the exact causes of breast cancer isn't fully understood, doctors say it happens when cells in the breast begin to grow abnormally and form a lump or mass. Some of the key risk factors include: 1. A family history of breast cancer; 2. Hormonal changes such as starting your period early or menopause later than usual; 3. Unhealthy lifestyle habits like lack of exercise, poor diet, smoking, and excessive alcohol use; and sometimes just age. The risk increases as one grows older. But remember, not everyone with these risks get breast cancer, and not everyone diagnosed has a clear risk factor. Early diagnosis saves lives. Early detection is the most powerful weapon we have. Every woman should know how her breasts normally look and feel. This makes it easier to notice any unusual changes like a lump or thickening in the breast or underarm area, changes in the shape or size of the breast, discharge from nipple that isn't breast milk, skin deepening, redness, or peeling around the nipple. If you notice any of these signs, don't panic, but visit a doctor immediately. Regular breast screens or mammograms can detect cancer early, even before you feel any symptoms. Health experts recommend that women aged 40 and above go for mammograms at least once every year or 2, depending on advice from their doctor. Healthy lifestyle and prevention. There is no guaranteed way to prevent breast cancer, but you can reduce your risk with simple lifestyle choices. This can be done by eating a balanced diet rich in fruits, vegetables, and whole grains, exercising regularly at least 30 minutes a day, avoid smoking and limit alcohol, and maintain a healthy weight. If you've had a family history of breast cancer, talk to your doctor about genetic testing and preventive screening. To all our viewers, remember, breast cancer awareness isn't just for October. It's an everyday conversation we must keep alive. Check yourself regularly, support loved ones, and spread the message of hope and early detection. Because here at Afya Clinic, we believe your health is your greatest wealth.
All right, you're back. That was such a wholesome segment. Thank you so much for that. And of course, we've been able to just understand what exactly that is and how you're able to stay safe. And I love that it's Faith Mwema, by the way, who's done the voiceover. So if you need a voiceover, reach out to her. Thank you, very important. Yeah. So, and she's mentioned that early detection saves lives. And she has mentioned that again and again and again. And I'll insist that early detection saves lives. So detect early, go to hospital, go for screenings. In fact, you're told that go for a full body screening or checkup at least once or twice a year.
Yes.
Yeah, just go get checked. You know, it's your body, take care of it at least once or twice a year, and that would be very important. Today we're here with Dr. Kate and we're talking about breast cancer. I see we have questions, very many questions coming in. I hope we'll have time to go through all of that, and I pray that we will. We'll try and make sure that we answer all the questions that you've sent. But before we do that, let's talk about the prevention. What are some of the prevention measures?
I think actually that's a good place to start, Rachel, because our greatest strategy will be to prevent the cancer from happening in the first place. If there's anything we could do to reduce our risk, that is where we should be putting our energy in. What are the ways that we can use to prevent or to lower the risk? I liked the health segment because they really mentioned the key pillars. Lifestyle. Lifestyle, I would say that. If we can get up and moving, that will be the best place to start, because most of our lives now are becoming more and more sedentary. We are doing, you know, people in the past had work that was hard on the body, but very good on the mind, you know. Now we are the other way around, you know. We are very gentle on the body, but we are very stressed out most of the time. And being stressed out gives you very high cortisol levels, so that your body is like constantly on overdrive, you know. And that sends the hormones all over the place, you know. So if we can get up and moving, if you can commit 30 minutes, of your day moving about, you'll have cut out your risk significantly. And it doesn't have to be strenuous, but it needs to be moderate intensity. And you do not have to do all the 30 minutes at once. You can do 10 minutes. Split them, do a walk. Or even if your work is really at the desk, you can do your work standing for 10 minutes. Then you sit down, let an hour or two go by, stand up again, do your work on your computer standing, because standing is exercise. It's not like sitting down. So we can get up and moving. You can do that jog in the morning or in the evening. If you can tend to your farm, for instance, or your vegetable garden yourself, that will be exercise. The trick is to be consistent. Be consistent. It doesn't have to be big, but it needs to be consistent. Another thing is weight control. We will say there's no good weight, but we can have optimal weight. Weight that allows your body to function at its best. So if you have your BMI checked and it's over, 25, that's getting dangerous, because over 25 you're overweight, over 30 now we call it obesity. As we said, the more fat cells you have in your body, the more the hormones are going to be off. So if we can work on that, it would really make a difference. Keep your weight at an optimum. Of course, life happens. Women do get children. You get, your weight goes up. But as soon as it goes up, always try to bring it back to your optimum. You talk about the shows, the older women. They may not be able to do that vigorous exercise, but let them be up and about. They can walk. Even if it's assisted, they can do it. It really does a lot to regulate not only the sugar in the body, but also the hormones in the body. Another thing, as we have said, and we'll keep singing, get checked. Get checked. You never know. A lot of the cancers that are detected are really not because someone felt a lump. It's because they were coming for their checkup and something was seen. The earlier you see it, the earlier you treat it, the greater your chances of success at the end.
I love that. Anasema, hello, my axillary lymph nodes has been inflamed 3 times every month. I'm a breastfeeding mom, but I went to the hospital and they said no mass. I should not worry, and no treatment was given. But I'm currently not inflamed.
I see. I think motherhood comes with its twists and turns, and I think perhaps that is just one, of those natural, it's just how it unfolds. But I am glad that she actually went and was checked, because many breast cancers will show themselves or they will demonstrate themselves during pregnancy and breastfeeding. So it does not mean that if you're pregnant or you're breastfeeding that you're safe.
Yeah.
Many of them actually will show up. That is when they will pop. That's when you'll feel that lump.
Yeah.
So I'm glad that she was checked because, as we said, not all lumps in the breast are cancerous. The same way, not all swellings in your axilla or your armpits will be cancerous.
Yeah.
But there will be no way to tell unless you're checked.
Yeah.
Yeah.
Okay. And so, hey, my left breast has been paining like 3 years ago, but lately this year the pain has been too much.
Yeah.
Also, 2018, my newborn alikataa kunyonya hiyo breast. This year, I took an ultrasound and they found nodes. I've been taking strong painkillers and antibiotics, but the pain is still there. What are these node infection and what can I do? Nikifanya kazi inaniuma sana. Please help.
I see. I'm sorry really for that. 3 years is a long time to suffer. Yes, 3 years really is a really long time.
Yeah.
I would suggest that if you've not had a specialist check you out, this will be a good time for her to be checked out.
Yeah.
It does sound though as if it is an infectious process or some inflammation of some kind, but it needs to be known where that is coming from.
Yeah.
If she's still breastfeeding, is her technique the right technique? Perhaps the baby is not suckling well.
Yeah.
Or perhaps the baby has an infection in their mouth that keeps reinfecting the mother.
Okay.
So you might really, it's hard for me to tell from here, but it does sound like an inflammatory process.
Yeah.
So what they can do, let them get checked by a specialist.
Yeah.
They will need to have some studies done, at least an ultrasound of the breast. If there is masses in there, the doctor can take a small tissue.
Yeah.
It's called a biopsy. Then we can have it examined.
Yeah.
Sometimes we say it's better to be checked and to be told there's nothing than to ignore and then later on you find out there was a problem.
Yeah, you're right. I hear you. I see there's someone who's asking us to talk about a certain topic here. We'll be talking about that. I know that we've talked about blood clots and things like that before, but Mukami, Nancy, I have seen your message. Thank you so much for that. Most of the other questions, I see that we've talked about them. There's someone who's asking, okay, so they're saying, good morning. I have a mass in my right breast, a bit painful, but it comes and goes. What could be the problem?
There is a mass. It comes and goes.
A bit painful.
A bit painful.
I'd want to know what a bit painful is.
Yes.
Because I know pain is relative.
Right, it is relative.
Yeah.
So let me say that there is no lump in the breast that is normal. Yeah. We may say it is not cancerous or it is cancerous, but it is not normal to have a lump in the breast. What that person should do is they need to have an ultrasound so that at least we can be able to know what kind of lump it is.
Yeah.
Let me also talk about pain in the breast. Pain in the breast is something that many women face just because of the natural cycle, you know.
Yeah.
Because of the hormonal changes and how they affect the glands within the breast.
Yeah.
So pain may be problematic or it may not be. It might be a sign of something sinister or it might not be. So the best thing for that person is for them to just have an ultrasound first. From the ultrasound we'll be able to know whether it is something worrisome or not.
Okay.
Yeah.
Okay. I hear you. Now, from the conversation that we've had today, I see most of the questions we've answered while we were having the conversation.
Yeah.
And we'll be giving the contact for ScanLab because, you know, Dr. Kate is from ScanLab, an amazing place, by the way. But even we've not answered any question, we'll be giving the contact so that if you have any question, you'd call and you'll get help.
Yes.
But from what you've talked about today, what would be your parting shot?
What will be my parting shot? First, let me say that breast cancer is really increasing in our population. It is, in fact, in East and Central Africa, it has been seen that in Nairobi particularly is where we have the greatest incidence.
Because of the population?
It is hard to tell, you know, because it is very strange, because why would cancer be concentrated in one place?
I wonder,
You wonder, is it that our environment has become so polluted? You wonder, is it our lifestyle? Is our eating habits off, you know? Are we so sedentary? What's really going on? Is it a genetic thing? There are many theories that are going around. It's really a subject of much study. I would like to say the best thing is prevention. Even though we look forward to the hope of cure, prevention still is our best shot. So what I would say, let's try and lower our risk, because that is the best we can do. We can lower the things that are known to be risk factors. Alcohol, for instance, sedentary lifestyle, being overweight, you know, smoking, prolonged use of hormonal treatments, you know. Those are risks that are known. If we can work on those, then we significantly reduce our chances of getting it. So that is one place we can start. Another parting shot now will be perhaps now for the movers and shakers, the leaders in this country. How much resources are we putting into this basket? Because it is a basket that will keep expanding. You know, as we go along, it is estimated that the numbers of people who will suffer this disease will only increase, you know. So how much resources are we directing there? Are we making available this screening, you know, tools that we are talking about? Can someone just walk in from their farm, go to the nearest dispensary and get basic screening done? Well, here in town, I guess yes. But back in the village, I'm not too sure that they will be able to. So increasing access once again to those who might suffer. Could be our sister, your brother, your wife, your child. I think it is a good time to, you know, for our leaders to reconsider. Whereas in the past, malaria, you know, diarrheal illnesses in children, those are our main concerns. You know, the ground is shifting. We need to move, you know, and keep in step. So that is what I would say. And for those who are affected, I would like to give them hope. There is hope.
There's hope.
Cancer is not the end. A cancer diagnosis is just the beginning of a new phase of life. A tough phase of life, but a phase of life nevertheless. So it is now upon the person who is affected to take the necessary steps. Many people turn to traditional healers, you know, and there are many influencers out there who even tout other modalities. Well, I would say go for treatment. If something has been prescribed, go for it. If there's something humanly possible that you can do, go for it. You know, explore those treatments, follow through with them. You should be fine. Yes.
Perfect. Now that's it and done. Thank you so much for being here today. We've had a very wholesome conversation. And I know for the people who've not been able to follow right from the beginning, we'll be able to just catch everything important that we've talked about, because we'll be having Mumbi in a very short while, who'll be taking us through the pointers that we've seen all through. But for the people who'd love to ask questions, once again, Dr. Kate is from ScanLab in Nakuru. So please share your contact so that people who would love to, you know, reach out, they'd be able to do that.
Thank you so much. Yes, I'm from GTB ScanLab Nakuru, where we are doing amazing things. We are there to support you, especially with your screening work. So if you need to have your imaging studies, your ultrasound, your mammogram, you need an examination, you need a pap smear. This is a good time to get a pap smear, actually, even though today we're not talking about cervical cancer. You can get all that at a discounted price. We have a discount applying of 30%. Once you visit any of our facilities. We are in D&D House, Nakuru. We are also in Polo Center, where we do our imaging studies. Any of those, you should be able to get assisted. But for those who might want to inquire, I'll want to give their phone number. 0722 149 505 or 0717 535 037.
Perfect.
D&D House, D&D House, Polo Center. That's where you'll find us.
All right. Maybe you can take the numbers again?
Yes, we'll take the numbers again. So 0722 149 505. Alternatively, you can call on 0717 535 037.
Perfect. Thank you. Thank you so much for being with us on this particular session today. It has been very wholesome and very educative.
Thank you. It was my pleasure.
Asante sana. Perfect. Now let's get into the Did You Know segment. Of course, this is where you just jig your mind kidogo after having a very intense conversation. Yeah. So we get to just jig our minds a little bit as we move to the other particular session, which is an amazing session where Mumbi will be coming to talk to us about what you've taken from today's conversation. For now, let's get the Did You Know segment. As you can see on your screens, is that you have a Did You Know that will jog our minds. Because did you know that some turtles can live without breathing for months? Not days, for months. Did you know that? Did you know that? For some turtles, they can live without breathing for months. Yeah? Did you?
No, I did not.
You did not. Because how can you are a living thing. Yeah? As much as you're a turtle. But again, it lives in water. Turtles do live in water, yeah? Partly. Partly. Is it partly or fully? Partly. Yeah? Partly. Yeah, but I think even fish, ambazo ziko kwa maji, they breathe. It's just that their breathing process is a bit different. So we'll get to, just learn more about that to see how are turtles able to live without breathing for months. And we'd also want to know how many months would they stay without breathing. We'd probably be speaking about months and we're speaking about 1.5 months, which is still a long time. Yeah, but 1.5 months? Just living without breathing for months, that's something. So please go and make sure that you check it out. Yeah, do a bit of research here and there. That would be good. How are you?
Hello.
How are you doing?
I am doing amazing.
How are you feeling?
I am feeling fantastic. Yes, I'm having a very good morning.
Amazing.
Yeah.
And you look amazing.
Thank you.
Perfecto.
Thank you.
Yeah. What have you learned from today's discussion?
A shocking fact that breast cancer is the second reason why women are dying.
Yeah.
That's very sad. It's a very sad
Very
statistic.
sad.
Yeah.
Very sad. And she was just speaking and was thinking, to be a woman. Because the first is cervical cancer.
And then breast cancer.
Breast cancer.
Oh, that's a lot.
We've talked about PPH after the women who excessive bleeding after birth. Because that's also something else, and just being a woman naturally predisposes you to so much.
Yes. So many risk factors. Yeah.
I was listening to some TikTok video and they said, apparently you can get pregnant, not in your womb and not in your fallopian tube, like not the...
Where?
It's crazy, like other parts of the body, like the liver.
Oh.
Apparently.
And can you carry to term?
No, of course.
Okay.
Yeah, of course.
That's a very interesting fact.
Well, I'm here saying, of course not. I wouldn't know.
Because you're not a doctor.
Because I'm not a doctor, but there's no case I've heard of.
Yeah.
That, because one, that pregnancy is very rare.
And risky.
Yeah. I don't know, maybe we'll just do more research on that. Yeah. Others, thank you for being here today.
You're welcome.
Yeah.
Let me introduce myself first.
Please, as we always forget to do that.
Good morning, everyone. My name is Mumbi Kariuki, and welcome to the Pointer segment, where we do a brief recap of what we've talked about, and also a bit of empathy. And today's topic was breast cancer. Yes.
Yeah.
So it's Pink October.
It is.
I love what people are doing on social media. There's a lot of campaigns. So many people are posting. Yeah. And I love that.
Yeah. And creatives are very creative.
Yeah.
They have a very good way of just posting about the Pink October.
Yes.
Which is really beautiful.
Yeah. People perish for lack of knowledge. So now that people know, and we are erasing the stigma that surrounds breast cancer. Yeah, and also, like, we've learned that breast cancer is not only for women, also for men. It's just that women are at a bigger risk. Yeah.
All right. Perfect. So for the people who aren't able to join in for the whole discussion, please take us through.
Yes, so today we learned a lot of things on breast cancer. And the first thing that we learned is that cancer is a disease where some of the body cells grow uncontrollably and spread to other parts of the body. So this is basically what cancer is, whether it's in the breast, whether it's in the liver, you know, wherever it is, cancer is where the body cells grow uncontrollably. Yes, so another thing that we learned today is that breast cancer is the second leading cause of cancer-related deaths among women in Kenya, coming after cervical cancer. Again, that's a very, very sad statistic. And I'm glad that we are doing Pink October, you know, just to spread awareness on the issue. Another risk factor is that risk increases with being female. So women are at a higher risk of getting breast cancer as compared to men. Older age, family history, obesity, lifestyle factors, and hormonal fluctuations. This, I actually didn't know about the hormonal fluctuations. That, you know, when you get your period too early or your period too late, you know, you can get breast cancer.
Imagine.
Wow, it is very interesting that, you know, all these risk factors, wow, they've changed how I see life and health and just my lifestyle in general. You know, making health conscious decisions.
On what you eat.
On what you eat.
You
especially
exercise. Your diet. Oh my God. And your exercise and living a sedentary life. You know, the people who, especially the 9-to-5s, you're always just sitting.
You're always sitting, number one. And then most people tend to have like 2 meals a day, just breakfast and supper. And then during the day, they are snacking on unhealthy, unhealthy things. You know, we have like, you know, snacks that are healthy. So have some guache.
Well noted.
A banana, you can have an apple. You don't have to have unhealthy snacks. Yes. So another important thing that we learned today is that the common symptoms include a lump in the breast or underarm, swelling, changes in breast size or shape, redness, unusual discharge, or persistent breast pain. So again, back to afya yako ni, you know, jukumu lako. You are responsible for your own health. You've been told that as a woman, you should be dressing before the mirror so that if there's any changes, you can tell. You should self-examine yourself. You know, if there's a swelling, there's a lump, even inverted nipples, discharge. Yes, and you know, usingoje until it's too late and there's nothing that can be done. So
and not only as a woman, even for men.
Even for men.
Because there's a percentage that affects men.
That affects men.
But as a society, we've come to a place where we assume that, this is a women's thing.
It's a women's thing.
So even the men, please make sure that you are very cautious. Know you're normal. So that when it's abnormal, you'll be able to know, this is abnormal.
This is abnormal.
I need to go get checked.
Yes, and not just for breast cancer, for everything else in general.
Your body in general. I think that's very important.
And also I'd like to say that these symptoms are not a checklist that you say, I have a, you know, I have a lump under my underarm, but I don't have inverted nipples, so it's not, you know. So like, just if you have at least one of these symptoms, you know, just go and get checked. You'd rather go and get checked and they tell you, it's a false alarm, instead of not going to get checked. And you know, later you find out you are in stage 4 and we could have prevented all of this. So another important thing that we learned today is that early detection saves lives. Get screened for breast cancer today. Today there are many centers, especially this month, where they're offering even free screening.
Imagine.
Why and would you not screening go? At discounted rates. So just go and get checked.
Go get
Prevention is better than cure. You'd rather go and get checked and they find nothing.
And they tell you, you know what, you're good, you're free of cancer. Enda nyumbani uko sawa. But go get checked. That's very, very important.
Very, very important.
Thank you so much. That has been such a good session. Thank you for taking us through.
You're welcome.
You are very, very attentive on behalf of everyone else. When you're nasikiza kifanyanga kazi ingine. So we've been able to just take you through everything that we've been able to talk about. But my highlight would be take care of your health.
Take care of your health. You're responsible for your own health.
You are responsible. You're responsible for your own health. I love that. So that has been it. Today being a Wednesday, we'll be having our lunch hours from 12:30 to 2:30 in the PM. So do not miss out. It's going to be amazing to be right here at Kingdom Seekers Fellowship Nakuru. So if you're in Nakuru, come, let's fellowship together. If you're outside Nakuru, we'll be live on Facebook, on YouTube, on our social media pages. And of course, we'll be live on TV and radio on MBC ITV. So do not miss out. Otherwise, my name is Rachel Kahuku. I've been your host for the day. Very glad to have you on board.
Yes, and I've been your host, Mumbi Karaoke. I hope that you have an amazing rest of the week.
Yeah.
Yeah.
Bye-bye.
Bye.